Hello everyone, this is Dr. Sin, your OBGYN. I'm coming live today from the greater Charlotte, North Carolina area, and thanks so much for joining our weekly sessions called Unveiling the Private Face. Thanks Amber for joining. Please like and share if you can. Thanks so much. We'll wait for others to join. Hi, Alicia and Lynn. Thanks, guys. Please like and share as you come in. Please like and share. So many may say, why do you want to talk about skincare of the vulva, or what I like to call the private face? Well, this area is very important to me. It's actually one of my pain sources. As many of you all may know, I cheered for the majority of my life, all the way through college. And as a cheerleader, you have to wear the shortest of shorts. And I struggled with maintaining that area for the cameras. Where do you get the information from to know what to do? Your family? Well, not mine. We really didn't talk about those things. Your friends? Well, I asked around, but everyone did not have the same grade of hair that I have, and sometimes that conversation was difficult, or it just was not fulfilling, at least for me. So for me, there was a lot of trial and error to figure out what works, what doesn't work, what causes pain and what doesn't. So many years I felt very alone. And I felt that I was probably one of the only people out there dealing with this type of problem. And so it was something that was very difficult for me to talk about. But once I became an OBGYN, I saw more and more women coming into my office with this complaint. I saw more and more women not complaining about it, but just trying to deal with it. And no one's ever talked to them about the vulva or the private face. So that is now my passion, really teaching women about the private face so that they can optimize the skin and become what I like to call vulvaceous. So as you join, please like and please share. Please like and share as you guys join in. I have my readers on today, so I don't have so many technical difficulties as far as reading the questions. And as we go on, if you have a question, please put it out there, and I'll try to stop through different areas and talk to you guys about whatever your questions may be. So let's go ahead and hop into this. And the topic for today is to shave or not to shave? That is the question. So many of us feel that shaving improves our hygiene. Shaving allows us to be a lot cleaner, or at least we feel cleaner. And that is the assumption of what's happening. So my question to you guys is, what's your stance? Is shaving, and I'm using the term shaving very broadly today. So for today, when I say to shave, I'm just simply meaning to remove the hair in the private face. Do you feel that makes you cleaner or not? Put your answers out there in comments. I'm just curious as to what you guys are thinking. And then we're going to talk about what it really means. Does anyone have an opinion? So, plenty of people feel cleaner when they shave, but that doesn't necessarily make it cleaner for you. Does that make sense? So let's talk about first the skin down there and the purpose of the skin. Okay, I see. I do not feel that it makes me cleaner. Okay. All right. Some prefer to shave. Can you comment as to why you prefer to shave? Some for the pool and swimming. That's the majority of women out there. Okay, so the purpose of the skin down there. The skin or hair down there serves two purposes. Number one, it's a barrier. That hair prevents other things from coming in. Okay, so always remember that that hair is a barrier. The second thing is that the hair down there is a sponge. It absorbs moisture. It absorbs sweat. I'm sure many of you guys have men in your family or men that you are friends with or associated with that are bald. And you know that it can just be a little bit hot outside or the sun partially up, and you will see them sweating profusely when everyone else is dry. They have that problem because there's no hair to absorb the sweat. So the same thing happens with women who choose to remove all the hair down there. There's no longer a sponge to absorb the sweat. Okay? So when we choose to remove the hair, when we choose to shave, we are removing our barrier and we are removing our sponge. Okay? So think about that. When we remove the hair, we remove our barrier and we remove our sponge. So what does that mean? Okay? What are the complications that you may see with shaving with doing that? Now, clearly, I'm not telling you to disregard shaving and not to shave. The true benefit of shaving is just aesthetically pleasing. That's really the only benefit to shaving. Or some may feel that with shaving, it's easier to maintain the hygiene when they're on their menses. Okay? Some may just want to shave the bikini line so things aren't noticeable, like when Lynn said, going to the pool or going swimming. So remember, the only true benefit of shaving is to make it aesthetically pleasing for you. Once again, I'm not telling you not to shave. It's that you need to understand the potential complications with shaving, how to ward those things off, how to identify those problems, and how to fix it. Okay? So, back to complications. So when we remove our barrier and we remove our sponge, we become at increased risk for yeast infections and bacterial vaginitis. Okay? Because number one, it's easy for things to get in. Number two, where does yeast like to grow? In warm, moist places, okay? And you just created a very warm, moist place. All right. Other complication is just being super sweaty down there. That's the risk that you take with shaving. Once again, I'm not telling you not to shave, but you have to understand what the complications are and be proactive in preventing those things or at least lessening some of the side effects. Okay, so if we choose to remove the hair down there, we can have a lot of sweating. We're increased risk for yeast or bacterial vaginosis. Our odor may change. Okay, our odor may be a little bit more pronounced. Okay, because we don't have that hair there. So that's just something to keep in mind when we choose to remove the hair from down there. The other thing that may happen with various forms of hair removal, especially when you're talking about shaving, is that it increases your risk for ingrown hairs. And if you develop ingrown hairs, you may be at increased risk to get hyperpigmentation and little darkening spots in the private phase. Or some women may develop little nodularities that never really go away. And sometimes with this folliculitis, okay, when you got the inflammation in the hair follicle, that can turn into a true infection that has to be treated. So it's important to, number one, look for all those things And number two, and probably more importantly, do what we can to prevent it. So the big things that I want to talk to you guys about tonight when you're deciding if you want to shave or not, or if you want to remove the hair or not, if you choose to, are you doing all the things you need to do to prevent problems? Okay, so a lot of those things were addressed last week. You know, we talked about with shaving that you do not want to use a dull razor. Making sure that razor is sharp prevents ingrown hairs. We also want to make sure that we're using a special razor for our special area. You don't want to use the same razor, okay, for your underarms and your legs that you use on the private face. The other thing that's important when we talk about prevention is some people may think it's weird, but it really helps. Using an exfoliator, okay? We use an exfoliator on our public face. So if you're removing all the hair down there, you need to try to use an exfoliator on your private face, okay? My goal in my women who are soon to be vulvaceous, who are watching this, is to get you to develop a routine when it comes to the private face. Because the more we pay attention to it, the more proactive we are with preventing problems and also identifying problems, the less issues you're going to have, okay? And you'll be able to optimize this area. So right now I'm going to stop and see what questions that you guys have out there. What questions do you all have? And if I missed the question, can you put it back up there? So last week, some people asked some pretty good questions. One question was, well, if you shave, what shave gel or shave cream do you prefer? So they all work pretty good, but I recommend a shave gel for women, and I recommend that it has some aloe vera in it, okay? And you definitely want to try to use an astringent right after shaving. Once again, treat your private face the way you treat your public face. So that was one of the questions. Another question that we had, here's a question. Miss Tia, any particular kind of exfoliator cream? None in particular. You just don't want it to be very harsh, okay? You want a soft exfoliator. So just go to your normal beauty product line and try to find something that's hypoallergenic. I try hard not to promote one particular product over the other, but the key is to make sure it's gentle and to make sure it's hypoallergenic because our area can be a little sensitive. So something to think about. Do you recommend Nair for the bikini area? Nair is fine for the bikini area, but for a lot of women, especially women of color, Nair does not work. Nair does not work for me. And that was one of my stressors in my former years when I was chairing, is that shaving really didn't work with a razor. Nair just really didn't completely get the job done. So I'm going to tell you what I did. Some may find a little strange, and things have gotten better over the years. But you know, without giving the exact name, a lot of men in our family who have issues with ingrown hairs, they used to, or still do, use a really stinky solution that came in like this black and gold can. If y'all know what I'm talking about. But believe it or not, that even works for women in the bikini line. Now you don't have to mix it yourself. It comes already mixed. The recommendation is to try a little small area on your skin to make sure you don't have an allergy to it or that you're not super sensitive to it. And if it works, why not use it? It's still a little stinky. But for some women, Nair absolutely works. For others, they need something a little bit stronger. So it doesn't hurt right now until my product line comes out. to look in the men's section and try that product for men. Okay. All right. Did I miss any other questions right now? Leave it on too long and you'll regret it. Absolutely. You got to pay attention to the time. And you want to do a sample area on your skin so you know how your skin reacts to the area. Okay? Especially if you're just doing the bikini line. Okay? So make sure that you sample the area. 1 second. Let's see. Yes. Thanks, Jessica. Thanks for joining. I did say that all the time. What I'm telling you guys this evening is the same thing that I tell my patients. Use a special razor for your special area. So keep all these little tips in mind. So last week we talked about not going commando in jeans. Once again, especially if you're removing all that hair down there, you have to be careful. All right. And it's important to make sure that you put on underwear that has a cotton bottom. All right. When you shave down there or remove the hair down there, you have to be more diligent at prevention than women who keep hair down there. Now, if you're only shaving the bikini line, not as much. But for women who are shaving the majority of the hair, you have to be more diligent than women who are, let's say, natural. All right, so just keep all those things in mind. Now, what do you do if you develop an ingrown hair? All right, because sometimes that happens. Warm compresses are key. So, my recommendation is to take a wash rag, wet it, put it in a microwave for like 15 seconds, okay? Blow it out because you don't want to burn your skin. Set it on an area for about a minute or two. Do that a few times a day, and within a few days, the hair should come up and you should be fine. Oh, Heather Price Bowles, good to see you. One of my former teammates, one of my former cheerleading teammates there. So, these are things that are important to do. So, if you get an ingrown hair, treat it quickly. Warm compresses is the gold standard, and that's what works. If you do the warm compresses and it's still not working, then I would get it looked at, okay? Because sometimes they need to be lanced. Also, when you're going through the process of shaving, not only can you develop the hyperpigmentation, but if you get bumps down there, they can take an extremely long period of time to go away. So always keep that in mind. So that's why prevention is so key. Make sure that that razor is sharp because you don't want to be lumpy bumpy within your private face. The other thing that you can do with hyperpigmentation is the same creams that we use over the counter, like Ombi. I'm trying not to say product names, but I really, really like them. Try that for your hyperpigment areas in that area and see how it works. A lot of women get great results with doing that. So these are some of the things that I want you to think about and be extremely, extremely mindful of. So right now, are there any other questions? All right, this is great. I'm so glad that so many of you all joined this evening. I know this is an important topic, especially in the summertime. It's swim season and all those good things. I really want to make sure that my women are protected and that they are doing the things they need to do to keep that area beautiful, because it's just as important as your public face. Now, once again, I am Dr. Sin, your OBGYN, national speaker, and vulvar skin specialist. Through my educational sessions and very soon my own product line, I help women to completely understand and optimize the skincare of the vulva. So, if you want to make sure that your private face becomes vulvaceous, Please follow me on all social media platforms at Dr. Sin OBGYN. So, if you think of other questions, please put it in comment. If I did not see your question tonight, I will do my best to get back at your questions. And every week we'll be here on Thursdays at 7 with different topics. And a lot of them I know you guys are going to enjoy. So, here we go. What is this? How do you feel about using Summer's Eve? I love Summer's Eve. And Summer's Eve is hypoallergenic, so it works great. You know, some women may have a little bit more discharge than others, especially if they're shaving. And so they can use the Summer's Eve's wipes. And those come individually wrapped, and you can just keep those in your purse. And I think that that's fine. Now, no douching, okay? I don't want anyone out there douching, okay? When you douche, you destroy your body's natural flora, your body's natural defense system. So that's not a good idea to do. If you don't feel that things are quite right, you can soak in a tub with some clear water, okay? If you want to put a little vinegar or something of that nature in the water, that's fine. But if you still have an odor, you need to get it looked at, okay? Because you might have bacterial vaginosis, and we definitely want to make sure you don't have anything else. All right. Probiotics. What's the word for what helps in that area? Probiotics are have a positive effect on the vagina and vaginal health. So I do recommend probiotics. I recommend eating a well-balanced meal daily, okay? And your water intake. When you are not drinking your water, your natural smells in the vaginal area are going to be a lot stronger, okay? So make sure you're drinking your water. Johnson's Baby Wash, that's fine. Not a problem there. It's okay to use Johnson's Baby Wash. Should you moisturize? Been told to use cocoa butter. So, it is okay to use a moisturizer down there, especially if you're shaving, because you do not want the area to become super dry. Now, you don't want to leave it wet when you get out the shower. That's a different thing. But it's definitely okay to use some cocoa butter. And my women who are perimenopausal or postmenopausal, we're going to talk about all those things in other sessions. I have them to use coconut oil if they're having issues with dryness in that area. So go to the baking section, get you a little jar of coconut oil. It's going to be solid, okay? And just take a little finger whip, and you can put that right on your folds, okay? You do not have to worry about coconut oil staining your sheets, staining your panties, anything of that nature. So that's okay to use. We no longer use baby powder down there for extended use, okay? Brazilian waxes. All right, guys, we are going to do an entire session on waxing. The pros, the cons, best places to get it done, how to get it done. There was a question last week when someone asked, is waxing better than shaving? Truly, one is not better than the other. Hey, Jane, how are you? Another one of my cheerleading buddies there. All right, one is not better than the other. With each, you need to make sure that you're being proactive and that you're using your precautions. And if you're doing that, you will be okay. Now, once you do these things, you're going, pineapple, facts or myth for vaginal health. Pineapples it definitely improves the smell, okay? So it is okay to use, to eat pineapples if you so choose. Now, as far as just making the vagina overall healthy, yeah, I'm on the fence with that, okay? But I have some special treats for you guys later on in other sessions where we're going to have some deep discussions about pineapples and other fruits and other things that we can do to improve the vaginal smell. Epsom salt. Well, you know how on our face, when we wash our face, some of us, our pores kind of are very enlarged. Well, that can happen with the private face as well. So soaking in a warm tub and adding a little Epsom salt will also help shrink those pores. All right, so that's just something to think about. So I think this has been a wonderful session. You guys, please like and share this post. I will be with you all every Thursday at 7 p.m. If you have additional questions, I will be checking the comments, add them on the comments, and I'll be getting back with you guys. Once again, I am Dr. Sin, your OBGYN, national speaker and vulvar skin specialist. My passion in life is helping women to understand and optimize the skincare of the vulva so that they can realize that this area can be just as special and just as beautiful as their public face. So if you want to learn how to make your private face vulvaceous, follow me on all platforms on social media at Dr. Sin OBGYN. That is Dr. Sin, C-Y-N, OBGYN. I love meeting with you guys. I'm looking forward to our Thursdays, and you all have a great evening. And if I missed your question, I'll be going through comments and looking for it, okay? Have a great weekend. Goodbye.